Ladies and gentlemen, welcome once again to another episode of the Think Clinical podcast. My name is Hamza. It's always good to be here. Thank you so much, everyone, for joining us as always. We really do appreciate all the support you've given us recently, and as the channel grows, we want to entreat you to remember to subscribe, like, and share, so that anytime we post new content, you'll be among the first to see or get a notification for that. So thank you once again. Today, like always, we'll be looking at some very important topics that really redefine the narrative in terms of what healthcare businesses should be looking at, or what healthcare business really stands for. And today we'll be looking at why certain very basic business principles really don't work when you are thinking about building a healthcare business. So I'll give you an example. We have the move fast and break things principle, and I'm sure most of you have heard about it, which is supposed to be one of the ways in which you build businesses. You build technology, especially general technology, general consumer technology products. And this has proven to be very effective in so many different ways, but unfortunately today what we are going to be talking about is how this does not work in healthcare. But also we will spend some time explaining some of the things or what actually works in terms of some of these principles. So please stay tuned and enjoy the rest of this episode. So when we look at this, we are talking about you hearing so many times that you have to move fast and break things, and it's really the rallying cry in the tech startups, and it's plastered on office walls when you go all the way from San Francisco to Austin, and mind you, it works, but it only works when you are building stuff like a social media app or a food delivery platform, not when you're building a healthcare business platform. But in healthcare, this, and because of what we stand for, this could be a very dangerous thing. So today we are going to be looking at, first of all, where is the lie here in terms of how this does not apply to healthcare. And then after that, we will look into what really works, or how we should be thinking about these when we are building especially healthcare technology tools. And we can delve into that. So let's look at some numbers. So according to the 2023 analysis by Rock Health, so digital health funding has dropped by 76%. So right after COVID in 2021, we have seen a 76% drop in healthcare funding, because after COVID, a lot of healthcare technology items started coming quickly. What is more revealing is not a market correction. This is just a reckoning, because what the principle that was applied then is the same principle that's applied in all businesses, and that's the move fast principle. So right after COVID, there was this very increasing need for healthcare technology adoption and implementation, and there was a huge shift of capital and attention into healthcare technology tools that could be used in case there's another pandemic, right? But these fell into the narrative of the move fast principle. So, and that was imported, and it left a lot of healthcare startups in the graveyard. So the funding has dropped by 76%. That's a lot of drop in healthcare funding. But if you think about this, when we say move fast and break things, what does it actually mean in healthcare? So when we look at a social media application or a food delivery app that is broken or has broken features, it probably means that you can't post pictures, or during your food ordering process, you probably cannot add some sites that you should be able to add based on what the other company is requesting. So that's what break means. But when you look at healthcare, broken feature can mean that you are handing someone an incorrect diagnosis. That's one. A broken feature might mean you are handing someone wrong medication because it's maybe a pharmaceutical app, right? A broken feature might mean you are handing someone the wrong dosage of a medication. A broken feature might mean you are compromising your patient data, which violates every single rule in patient privacy. So here's the research that matters. A study published by the Journal of Medical Internet Research analyzed 47 failed digital health startups, and the number one cause for failure, listen to this, is not a lack of funding, it's not competition, it's not because there's hyper competition. It was launching products before achieving clinical validation, and this is where I need us to pay attention to. So they move fast, they broke things, and those things were trust, safe protocols or safety protocols, and then patient outcomes. So when you look at these, then you then understand why some of these tech startups right after COVID started sinking, and why most PEs and venture capitals are moving away from putting more funding into healthcare. So let's talk about Theranos for a moment, because Theranos has become a cautionary tale for everyone to reference, and this truly falls into that category of moving fast and breaking things, and what the implication of that could be. Theranos weaponized the move fast mentality in an environment where it could never work. So in healthcare, when you prioritize growth, prioritize media attention, and prioritize valuation over the one thing that healthcare demands above everything, which is validation, then you lose everything. And that is some of the challenges that Theranos faced. So what this case revealed, according to the SEC investigation, is that the company ran approximately 1.5 million blood tests with equipment that did not work properly. So that is what broken in healthcare means. When you don't pay attention to validation, to trust, to safety, then you break all those, and then there's no coming back. And there was not so real tests affecting patient care decisions, because now all those tests that were supposedly not interpreted properly were now affecting patient decisions. So again, the move fast philosophy didn't just break a company, it broke the trust between patients and innovations overall. And this is where we need to be paying attention to, especially for those of us who want to stay in healthcare business and healthcare entrepreneurship in the long term. Now, why the move fast again doesn't work, and I'm going to go through some of the different reasons why these don't work, is that first of all, healthcare is heavy with regulations or regulatory apparatus. There are things in place that are supposed to keep people working the way they should. So in normal tech, you can just launch a product and iterate based on user feedback. So if the person says, well, I did it, the restaurant got my order, I got my meal delivered, then it works. In healthcare, you have to face a lot of regulatory clearance. FDA clearance alone would probably take you about 18 months for less dangerous products, to several months for products that are most likely going to impact human life. HIPAA compliance is one of those things. State medical board regulations are there, insurance credentialing requirements are there. So there are a lot of regulations that doesn't make the move fast mentality even feasible in healthcare. So you can't move fast through this regulatory framework. They have their own timeline, you have to go by them. The second thing that you need to do is that there's a cost to being wrong. And in healthcare, the cost to being wrong, and this is why you don't move fast, is human life. So it's very dangerous when you compare or translate that directly from a social media app or a food delivery app or any other consumer app to healthcare, where the price of being wrong is high. So again, another reason why moving fast is a dangerous situation, and applying that directly in healthcare. Now, the third reason why it takes time and the move fast mentality doesn't work is because clinical validation takes time, and there's no shortcut to that. So a peer-reviewed study by JAMA looked at the digital health tools claiming to improve diabetes management. So out of 1,400 analyzed, only 2.7% had any peer-reviewed evidence supporting their claims. This is less than 3% of the 1,400 apps that were analyzed that actually were supposed to be diabetes management tools. So what actually scales, or what actually works? Because right now we've established that the move fast and break things mentality doesn't really translate into healthcare. Well, this might not be as catchy as the move fast, break things mentality or the unwritten over walls. But in healthcare, you have to keep in mind that you have to build slowly, validate obsessively, because the validation bit of it is what will determine how successful your program is. And you have to scale deliberately. I'll say that again. You have to build slowly, you have to validate obsessively, and you have to scale deliberately. So it's not as catchy as I said, but it's what works. This is the first strategy. Start with clinical validation, not market validation, when you are applying or trying to launch a healthcare app. So if you look at Epic Systems, the company really, it powers over 250 million patient records. And if you look at their history, they did not move fast. They spent years and years and years building relationships with clinicians, understanding workflows, and ensuring that their systems actually improved healthcare delivery before they were able to move forward with it. So when they came forward, they were able to meet all the three things. They built it slowly, they validated obsessively, and they scaled deliberately. Their competitor, anybody who tried to move very fast, is their competitor. And where are they now? They're all in graveyards because they just burned through millions of dollars and they couldn't even compete with Epic. The second strategy when you want to get this right is to embrace the regulatory friction as a feature, not a bug. So the mindset is that FDA approval isn't a barrier to your business, it's a moat around your business. So you have to look at it that when once you have it, competitors can't just copy and undercut you. They have to go through the same rigorous process before they can get that down. And the third strategy that actually works is build trust before you build scale. And Harvard Business School research on healthcare innovations found that successful healthcare companies spent an average of 18 months in pilot programs with clinical partners before attempting to scale. And this is because in healthcare, referrals and institutional drive adoption is what really makes you successful, not your app store rankings. Now, the real competitive advantage you have here is that healthcare isn't slow because it's inefficient. It is slow because the cost of being wrong is human life. And here's what most entrepreneurs miss. That slowness isn't your enemy, it's the opportunity for you to build a really robust program. So because you are willing to do the hard work of clinical validation, regulatory compliance, and building trust, especially with your clinical team, you build a business that is really defensible. That's where your true competitive advantage comes from. So in effect, this is all the things that I need you to really ruminate on over the next week before our next episode, because the next episode I will be talking about something that's very related to this, and I want you to be able to really think about this because it's related in a way that when we are able to appreciate where the differences are between healthcare innovation and other innovations, it really helps to reduce the frustration as we scale, and it actually sets the expectation right, especially when you're working with investors. So this has been another episode of the Think Clinical podcast. Thank you so much. It's been amazing, and we will see you in our next episode. Please remember to subscribe, like, and share, and take care.